We're good.
Good afternoon, everyone. Thank you for tuning in on our very first Ask Me Anything edition here at CCI Health and Wellness Services. We are transmitting live from Greenbelt, Maryland. We are very, very lucky today to have two of our very esteemed clinicians with us. Dr. Ben Simpson, he is a pediatrician at Greenbelt at our Greenway Center, and Dr. Lois Wessel, she also practices at our center in Silver Spring. And is a faculty member at Georgetown University. So, bienvenidos a nuestra primera edición de Pregúntenos cualquier cosa. Y hoy vamos a estar hablando con dos médicos, dos miembros de nuestro equipo clínico, el doctor Simpson, que es un pediatra aquí en Greenbelt, y la doctora Lois Wessel, Luisa, que ejerce en nuestro centro de salud en Silver Spring. Bienvenidos. Welcome.
Thank you for having us. Un placer.
El placer es nuestro. Thank you for being here. We have an afternoon filled with questions about vaccines for kids. It's a topic that is in everyone's minds. Vamos a hablar sobre las vacunas de los niños y tenemos varias preguntas. We have a lot of questions that people have sent us ahead of time. One of the first questions that comes from our chat is, what happens if I miss a dose? ¿Qué pasa si me falta una de las dosis de la vacuna?
So a good question. So if you miss a dose of a vaccine, that's okay, but we do want to get your child caught up as quickly as possible because they might be susceptible or at risk for those infections. So the best thing to do would be to call the clinic and get them seen as soon as possible so we can get them vaccinated and up to date.
Luisa, do you want to translate that?
Sure. Está bien si pierde una dosis de la vacuna. Sin embargo, si no ha venido a tiempo para su cita, se puede venir, se puede llamar a la clínica para hacer una cita porque queremos darle la vacuna lo más pronto que sea posible. And the other thing I was going to add to that is that right now kids are doing their school classes from home, and most of the school nurses have been sent to do contact tracing or work in the call center. But one day, and hopefully soon, when the kids go back to school, they won't be permitted to be in school and to do some of the things they like to do, like go on the field trips or in the summer go to summer camps if their vaccines aren't up to date. So it's better to do it now while they're home from school, so that when school starts up again in person, they can be all caught up to protect them, and also so they get to participate in the activities at school.
Es cierto, si los niños no están vacunados, no van a poder participar en ninguno de los eventos deportivos una vez que las escuelas abran. In fact, Prince George's County sent a deadline for when kids need to be vaccinated. So they are requiring folks to keep up with their vaccination schedule. Las escuelas del condado de Prince George's están exigiendo que los estudiantes sean vacunados de acuerdo a los estatutos ya programados por los departamentos de salud. So, yeah.
En el condado de Montgomery, las enfermeras en este momento están trabajando en hacer los contactos con gente que han sido expuestos a COVID o están haciendo otras tareas que tienen que ver con su trabajo de ser enfermera. Sin embargo, no están viendo las vacunas que tienen los niños, pero cuando regresamos a la escuela cara a cara, las enfermeras van a tener que trabajar en eso y si su hijo no está al día con las vacunas, no va a poder asistir a la escuela.
Yeah, that's right. And so some of the other questions that have come through the different social media outlets here. Is it safe to bring a baby during COVID pandemic, during the COVID era, to a health center for vaccination?
Sure. Yes, it's safe. We take every precaution possible in our waiting rooms. People are sitting 6 feet apart. You're in a room by yourself while you're waiting for your clinician to come in. We all the time are wearing masks. So it is much better to come in where we are able to do social distancing and get that vaccine that you need to protect yourself or your child from diseases, then not do it. So we are taking precautions in our waiting room and in our rooms to make sure that it's safe for you to come in for not only your vaccines, but your preventive care in general.
Y la pregunta para los amigos que están viendo fue sobre si es seguro traer a sus hijos al centro de salud durante esta época de la pandemia. Y en realidad sí, porque estamos tomando todas las precauciones necesarias para asegurarnos de que su salud y de su seguridad están protegidas. Todo el mundo usa máscaras, todo el mundo está sentado separadamente, entonces sí está, el espacio está 100% seguro para que pueda venir a visitarnos sin problema. Dr. Simpson,
Yeah.
what could happen to a kid that does not keep up with their vaccination schedule?
Yeah, thank you for that question, because I was about to answer that as well. So just one thing to add to Los Wassel's answer. We are also taking temperatures of every patient that comes in the door. And just remember that babies under the age of, or kids under the age of 2 don't need to wear masks, but everyone over 2 does need to wear masks. And so then to answer your second question about what happens if they don't get vaccines. So the vaccines that babies get, we give them to kids when they're young because we see these viruses, we see these bacteria still. For example, pertussis is something that especially little babies are at high risk for, and it can cause really serious complications and even death. And that's why they get it at 2 months, 4 months, and 6 months. And so we really need to see those babies at that time to protect them from those viruses and vaccines. Measles is another example. For example, last year, we're seeing some people not getting their vaccines. And last year, we actually had an outbreak of measles, and 128 people, I believe, were hospitalized last year. So these are things we're still seeing, and we really need to make sure that individual people are protected and our communities as a whole are protected.
Luisa?
Sí.
Sorry, that was a lot.
No, that's okay. Bueno, hay algunas cosas que el doctor Simpson me corrigió, que bien es cierto que estamos usando máscaras o mascarillas en la clínica, sin embargo, los niños bajo de 2 años de edad no tienen que usar máscara. Y la otra cosa, estamos tomando la temperatura de todas las personas que entran a la clínica y cabe señalar que nosotros, como los trabajadores de la clínica, también tomamos nuestras temperaturas para asegurar que no estamos empezando a caer enfermitos con COVID. Entonces es otra protección en cuanto a COVID. La otra cosa que dijo Dr. Simpson es que los niños chiquitos están expuestos a muchas enfermedades, bacterias, virus, como uno es la tosferina, y por eso le damos la vacuna a los 2 meses, a los 4 meses, a los 6 meses, porque los niños pueden enfermarse con tosferina, puede ser grave, hasta puede causar la muerte para un recién nacido. Mencionó también que el año pasado hubo una pequeña epidemia de sarampión, en cuanto a habían 138 casos de sarampión por falta de no vacunar a los niños, y eso también puede ser grave y puede causar la muerte.
Sí, gracias por la traducción. And so, Dr. Simpson, you talked about 2, 4, 6 months. What is the regular schedule, the regular vaccination schedule for a kid?
So I will say that some clinics, it may change a little bit, although there's typically about 2 different schedules that clinics use. So in our clinic, and it depends on the different combination vaccines that you use. So the vaccine schedule that we use here at CCI is 2 months, 4 months, 6 months. They have a 9-month visit, and usually that's for flu and to get blood work. 1 year, 15 months, and then usually there's another vaccine either at 18 months or 2 years of age.
Eso quiere decir que hay vacunas a los 2 meses, 6 meses, no, 2, 4, 6, una visita a los 9 meses, que es una visita para chequear la sangre, para el plomo, para anemia, pero no hay vacunas. Después a 1 año y después a 15 meses, a veces a 18 meses. Pero también es importante señalar que nosotros tenemos muchos niños que están recién llegados de sus países, un poco menos ahora con COVID, pero tenemos una clínica de gente con familias que están pidiendo auxilio político, y puede ser que lleguen de sus países y no tienen las vacunas, no están al día con las vacunas. Entonces un trabajo que hacemos es ponerles al día con todas las vacunas que hubieran tenido en la niñez, pero a lo mejor no lo tuvieran o su sangre no señala que tiene suficiente anticuerpos o protección en contra de ciertas enfermedades y tenemos que revaccinarlos. I was mentioning that we also see older kids, many of whom are recently arriving in the United States either through political asylum or refugee families, a little bit less now with COVID, but older children whose vaccines aren't up to date or we don't have records or their blood tests don't show they have enough antibodies or protection. And so we can do catch up with older kids who may have missed some of those immunizations that we give to smaller kids.
Mhm. And a question just came in through the chat. What happens since you don't have the records for their vaccination? What happens if they already have the vaccine and you're giving it to them a second time?
Right. So there's two answers there. One is that we do on some of our refugee and asylum patients do blood work to see if they have enough immunities, and that is helpful. But the other is that we often revaccinate, and it doesn't matter that they've been previously vaccinated. It doesn't hurt them to receive an additional dose of something that they may have gotten in their childhood. And one of the things that I've noticed is that many times they do have records which show they got the right number of vaccines, but the timing wasn't quite right. And so if the timing is not right, they don't develop sufficient protection against the disease. And I also wonder sometimes how the vaccines were kept in some of these other countries. Were they out in the heat? Were they in a refrigerator that didn't have appropriate temperature controls? And so sometimes I wonder if some of the vaccines they got in their countries of origin just weren't quite as fresh and potent as the ones that we give here. So we do revaccinate, and there's absolutely no problem to be revaccinated. Estaba mencionando que muchas veces a través de las muestras de sangre sabemos que no tiene suficiente anticuerpos o protección en contra de una enfermedad y le podemos revaccinar. Otras veces viene con un papelito, una tarjeta de su país donde tiene las fechas de sus vacunas, pero las fechas no están de acuerdo con el horario que usamos acá. A veces lo dan demasiado sin suficiente tiempo entre vacunas y eso puede causar un problema que su cuerpo no desarrolla apropiadamente los anticuerpos o la protección. O muchas veces las vacunas pueden ser que no estuvieran bien controlados en cuanto a la temperatura o algo en su país. Entonces nosotros tenemos que darle otra vacuna, pero no hay ningún problema para el cuerpo recibir una vacuna adicional para darle suficiente protección.
That sounds great. Dr. Simpson, you mentioned combination vaccination. What is that?
So there are a lot of things that we want to protect babies from and young kids from. And so to cut down actually on the number of shots that we have to give, the number of injections, we have combined different vaccines into one vaccine. So it's fewer shots, but still all of the vaccines that they need, all the protection they need. And so, for example, Pediatrix is one that we have here, and it contains diphtheria, tetanus, pertussis, polio, and hepatitis B in it. So they get all of those just in one shot, and they're still very safe. They're studied extensively to make sure they're safe, and it cuts down on the number of shots, so it's nicer for the babies.
O sea, que hay algunas vacunas que son en combinación, que hay uno que nosotros tenemos acá que se llama Pediatrix, que tiene DPT, que es difteria, tosferina, tétano, además tiene hepatitis B, poliomielitis. Entonces son 5 vacunas en una sola inyección.
So, menos puyaditas al bebé.
También mucha gente han escuchado el MMR. Many people have heard of the MMR, which is measles, mumps, and rubella, que es paperas, sarampión y rubella.
Mm-hmm. And somebody just said, I thought polio was eradicated.
So there are still some countries where polio does still exist. And so I think the most recent news was it was eradicated in, I can't remember, I'm sorry. so it was recently eradicated in a certain area. However, there's still areas where it does exist. And so right now they are still recommending that everyone get protection from polio.
Que se ha erradicado polio en la mayoría del mundo, pero hay unos pocos casos en unos ciertos lugares, entonces se recomienda que todo el mundo reciba la vacuna en contra del polio.
And that speaks to another point, which is some people ask, can we stop vaccinating against some of these other things because we don't see them anymore? But as I mentioned last year, we saw the measles outbreak, and so what happens is when we, if we stop vaccinating, it gives these viruses or these bacteria time to kind of come back into the community and come roaring back if nobody has protection from them.
Si dejamos de vacunar, eso da un chance a las enfermedades regresar a la comunidad en fuerza, porque puede ser, es como el COVID, que una o dos personas que tienen COVID, de repente todo el mundo lo tiene, igual con otras enfermedades bacteriales y viruses. Si viene una persona de una parte donde no tuvo acceso a una vacuna y poco a poco la gente empieza a enfermarse de la enfermedad, puede ser que se crece mucho. Y hay que recordar, hay gente que tiene muy bajos inmunidades por tener cáncer, por tener HIV, y se pueden enfermar con más rapidez en contra de algo si no reciben las vacunas. There can be people who are immunocompromised, cancer patients, HIV, people living with HIV who may be more susceptible to getting something. And so that's why it's so important for everybody to be protected, so we don't give it to our most vulnerable members of our community.
That's good to know. We have received a question from Facebook. Our viewer said, child received tetanus vaccine last year. Does she need to be vaccinated for Tdap?
So the question was if they got tetanus last year, and then the question is if they need to get Tdap again. Is that correct?
If they need to get Tdap, yeah.
Okay. So it depends on the child's age, and it depends on how many doses they've got and if they've gotten Tdap before. So we do usually children at age 11 get a dose of Tdap because that has pertussis in it. And as I mentioned, pertussis is a bacteria that we actually still see not uncommonly. I've seen several cases myself. And so we realized that we weren't having lasting protection from pertussis, so we added that booster at age 11. So you have to make sure that they got that shot at 11 years old. So it really depends on the patient, and it's better to call and talk to your doctor to verify that they received the vaccines they need.
Depende de la edad, que puede ser que necesitan un refuerzo, un booster. Realmente depende de la edad. Y cabe señalar que a las mujeres embarazadas también le damos Tdap, o sea, la vacuna de tétano con tosferina, porque queremos proteger a las mujeres embarazadas y que se protejan a sus bebés cuando nazcan. I said it's important to point out that we also give Tdap during pregnancy because in addition to the tetanus, they get the pertussis vaccine, and they need that to protect themselves and to protect their newborn babies.
That's great. There was another question. Is it true that if I miss a dosage, my child is more at risk?
So it's a good question, and it depends what it is. But if they're not fully vaccinated, we've studied the vaccines, and we know if they follow the schedule, they're protected. Mm-hmm. So if they're not following that schedule, we can't say for sure that they're protected. Mm-hmm. And for example, we've talked a lot about measles, mumps, rubella. And for that, for example, even if you get both doses and you're fully immunized, it only protects you 97% of the time. So there are still these small risks. So missing that one dose, for example, if you only have one dose of measles, you're only 93% protected. Mm-hmm. So yeah, so it is possible that you're at increased risk if you're missing a dose.
Sí, es posible que tiene más riesgo si se pierde una dosis. Realmente depende de cuántas dosis ha recibido. I also want to point out that I'm old enough to remember that when the varicella or the chickenpox vaccine came out, we only had one. You only needed it once. And over time, they realized that it wasn't providing sufficient protection and that we had to give a booster shot for that. And so that's just one example of a vaccine that's been invented in my lifetime, thankfully, because I was 29 when I had chickenpox, so I was quite sick. But when it first came out, we didn't know that one dose wasn't going to be sufficient. So we're always learning more about vaccines and how we can combine them or how we can make them better. Estaba mencionando que hay vacunas que yo recuerdo de mi vida, por ejemplo, lo de varicela. Yo no tenía la vacuna de varicela y me enfermé de varicela a los 29 años. Sin embargo, cuando ya inventaron la vacuna en contra de varicela, nosotros dimos solamente una dosis. Y ya con el tiempo nos dimos cuenta que se requiere 2 dosis para tener más protección. Entonces estamos siempre aprendiendo más sobre la cantidad, la dosis y cómo podemos combinar las vacunas para que no haya tantas inyecciones que tenemos que dar a los niños.
Uh-huh. Tenemos otra pregunta en español. ¿A qué edad le puedo dar el flu vaccine a mi hijo?
Okay, so the question was, at what age can you start giving the flu vaccine? And starting at 6 months is when babies can start getting the flu shot. And I recommend as soon as they turn 6 months to start getting the flu shot. And the very first year that babies get flu shots, or the very first year that anyone under the age of 8 gets a flu shot, they actually need to get 2 doses of it a month apart. So that is important to help build that immunity. And then every year after that, it's important to make sure you get your annual flu shot because the flu shot is one of the deadliest viruses that we see every year.
Y a los 6 meses se puede empezar con la vacuna en contra del flu. Y para una persona o un niño que está recibiendo la vacuna del flu por la primera vez, el primer año son 2 vacunas con un mes de separación entre el 1 y 2. Después de esto es una vez al año y es muy importante que le dan la vacuna del flu porque la influenza puede ser una enfermedad grave hasta que se puede morir de eso. También es importante señalar para la gente viejita, o sea, más de 65 años, la dosis de flu es una dosis un poco más fuerte, es otra dosis para la gente mayor. Entonces, estamos hablando generalmente de los niños, pero hay vacunas muy importantes para los adultos. Y los adultos que pueden tener otro problema, como diabetes, hipertensión, le damos una dosis de flu que es más potente para protegerles. I was mentioning that we've talked about children, but it's also important to point out that grown-ups need adults too. And after, I think at 65, we give a bigger dose of the flu shot for the elderly who may have diabetes or hypertension to make sure that they're well protected.
And just, I think the flu shot is probably one of the best things we can do to keep ourselves healthy every year. And so I do want to talk a little bit more about the flu shot or influenza vaccine. And it's because a lot of people confuse getting like regular colds, the common cold, which can be caused by like rhinoviruses or RSV. There's many different viruses in the community. Those ones are separate from influenza. So influenza is much more severe. That's you think about 5 days of fever and pneumonias, and we see many, many complications, hundreds of thousands of hospitalizations, tens of thousands of deaths every year. And so, that's why I really want to explain to parents, it's not the regular common cold that we're protecting against. It's this very, significant virus.
Dice el Dr. Simpson que la vacuna en contra de influenza es muy importante porque no es simplemente gripe o malestar por 5 días, es una enfermedad grave que cada año puede causar miles de muertes, de hospitalizaciones. Entonces es bien importante que todos recibimos la vacuna de flu en contra de la influenza porque puede ser mucho más grave que gripe, que hay un montón de virus que están por allá, que el rhinovirus se llama uno, o otro que en inglés se dice RSV, que nos pone un poco enfermitas, pero no tan grave como la influenza. Entonces es importante señalar que la influenza es grave y tenemos maneras para prevenirlo a través de la vacuna.
And I think, and I'm sure Leslie agrees with me, this year we're, I think, even more nervous about the flu because of everything with coronavirus and worried about our hospitals getting overrun and filled to capacity and really trying to keep people out of clinics and keep people from getting sick in the first place if we can.
Estamos aún más nerviosos sobre la influenza este año por lo de COVID. Queremos asegurar que no ponemos mucha presión y trabajo encima de la gente en los hospitales que están trabajando con pacientes con COVID. Es tan importante este año recibir la vacuna en contra de la influenza para que cuando uno se enferma sabemos que no es la influenza, porque han sido vacunadas en contra de esta enfermedad.
We have another question that came through. Can you get the flu vaccine with a cold? If you have a cold.
So my feeling is probably if you have a cold in general, the fact that we're all wearing masks and things now, that should help. But probably if you have a cold, you probably should stay home so other people don't get sick. However, I think that every visit to the clinic is an important visit for vaccines. And unless it's contraindicated, meaning that you can't have it for some reason, and it's very rare, you have a very high fever, or you've had a reaction to a vaccine before because you're allergic to something in the vaccine, which again is very rare, or occasionally because you're pregnant or you're living with somebody in your home who is what we call immunocompromised, somebody who has problems with their immune system. Sometimes there are reasons why we can't vaccinate, but those are so few and far between. And I would prefer that people get the vaccine, even if they have a little bit of gripe, a little bit of a cold, than not get it, because we don't know when we'll see them again. It may be a month, and in that month's time, they could actually get the flu. So it's preferable, even if they are feeling a little under the weather, for them to get the flu shot.
A question that just popped into my head. You talked about allergies. Why do we ask people if they are allergic to eggs?
So it's a good question because actually, even if you have an egg allergy, almost always you can actually still get the vaccine now. That used to be something we used to tell patients. But now, even if you do have an egg allergy, most of the time you can get the vaccine. You just need to tell your healthcare clinician. The one thing is, if you do have an egg allergy, usually we recommend making sure that you're getting it like in an office setting, where if you do have a severe reaction, we're ready to handle any emergency if needed.
Vaccines, many of them are produced, the way they're produced is they use the proteins from eggs to fabricate the vaccines. To grow them. Eggs are very rich in nutrients, and it helps them make the vaccines. But as Dr. Simpson was saying, almost always, even if you have a egg allergy, you can get the vaccine. And again, I think it's very rare to have an egg allergy. Sometimes people get some skin rashes from eating eggs, but that's a sensitivity. It's not an allergy. They don't get an anaphylactic reaction.
And those are the patients that we worry about who have an anaphylactic reaction. So, lips and tongue swelling, wheezing, trouble breathing after they ingest eggs. Those ones you need to talk to your doctor before you get the vaccine, because in those ones it is recommended to hold off.
If you're a baby that has not eaten eggs yet, how do you know?
So an excellent question. So what we've learned is, one, young babies actually can eat eggs, and we found that severe reactions are very rare, and the number of severe reactions to the flu vaccine is severe reactions is 1 in a million or so. So it's very, very safe. Young babies can get it even if they haven't had eggs, because that risk is so low. And typically, like I said, young babies don't have severe reactions to eggs at that age anyway.
Para resumir, que aunque tiene alergia a los huevos, generalmente se le puede dar las vacunas.
So if we're asking people to come and get vaccinated, even if they miss a dose, and even if they're not feeling 100%, we want them to come. How can they come? What is the steps they need to take to come here and get vaccinated and get cut out?
Call and make an appointment. Haga una cita en la clínica. Le podemos poner al día con las vacunas.
That's simple, right? Call the number that's scrolling at the bottom of your screens to make your appointment. We have health centers throughout Montgomery County and right here in Greenville. If you want to see Dr. Simpson, come to Greenville. He is a wonderful pediatrician, loved by all. And if you want to see Dr. Wessel, she is practicing out of Silver Spring and loves seeing people of all ages.
And I wanted to mention one more thing. I know we've been sort of focusing on pediatric patients, But it's important to remember that teenagers need vaccines. We give the human papilloma virus vaccine. We give a meningitis vaccine to teenagers, and of course the annual flu shot. And at some point they need a booster on their tetanus. And adults every 10 years need a tetanus shot. And after 50, they also need a shingles vaccine. And later on a pneumonia vaccine. So vaccines are really something that go throughout the lifespan. And obviously we focus on children because we really want to get them set for life in that first year. But there's other vaccines that we give throughout the lifespan as well. Estaba mencionando que hemos enfocado mucho en la pediatría y los niños y la vacuna que necesitan, pero también quería mencionar que los adolescentes también necesitan vacunas en contra de meningitis, el virus humano de papiloma, y ya los adultos también en contra del tétano, y más adelante, después de los 50, en contra de un tipo de varicela que se me olvidó cómo se llama, shingles, herpes zoster. Y también después de 65 una vacuna en contra de neumonía. Entonces realmente las vacunas ocurren durante toda la vida para protegernos. Empezamos con los recién nacidos para darles una base para seguir saludable, pero también hay otras épocas de la vida cuando uno necesita vacunas.
Y no nos olvidemos de la vacuna de la influenza también a través de todo el resto de nuestra vida. So flu vaccine for everyone from 6 months on. I want to thank our very, very dear Dr. Simpson and Dr. Wessel for spending this 30 minutes with us talking to our friends out there in the interwebs about vaccines and what we need to know. Please stay safe. Gracias a los doctores Wessel y al doctor Simpson por haber estado esta tarde con nosotros hablando sobre las vacunas de los niños. No se olviden de las mascarillas, es muy importante que cuando estén afuera estén usando mascarillas y hasta la próxima vez. We'll see you next time. Thank you for tuning in.
All right, thank you.
Gracias.
Gracias.